everyone. In this lecture, we'll be trying to understand anatomical terms in a very easy to understand manner. Anatomical terms are the terms that are used in anatomical descriptions. And anatomy, this is the term that are used for the study of structure of human body. And physiology, this is the term used for the study of various functions of different parts, different organs of the body. Let's see what anatomical position is about. In anatomical position, the person is standing straight. You can see that in the diagram. The person is standing erect and with head facing forward. Head is facing forward, and the hands on the sides. Hands are on the side, and with the palms facing forward. The palms are facing forward, and feet kept together. And this is the universally accepted normal anatomical position. The anatomical terms related to position. The anatomical terms that are used in relation to position include anterior or ventral. The structure which is located nearer to the front of the body is anterior. It's considered anterior or ventral. Example, sternum is anterior to heart, and cornea is anterior to the lungs. Sternum is a breastbone, and posterior to that, heart is located. So, sternum is anterior to heart. And another term is posterior. The structure which is located nearer to the back of the body, and the heart is posterior to sternum. A lens is posterior to cornea are its examples. And superior, the structure is located nearer to the head, nearer to the top of the body. Example, nose is superior to mouth. It's a very simple example. Lung is superior to the diaphragm. Then inferior, the structure is located nearer to the foot, away from the head. Example, mouth is inferior to nose, and stomach is inferior to heart. You can see that here. Superior, which is nearer to the head. The structures that are nearer to the head are superior, and the structures that are nearer to the foot are inferior. The structures that are nearer to the front of the body are anterior. Structure which is nearer to the back of the body is posterior. Then the next is medial. The structure which is nearer to the midline of the body. Nearer to the midline of the body. This is midline of the body. The structure whichever is nearer to the midline is medial. The structure which is nearer to the midline of the body is medial. Example, ulna is medial to radius. Radius and ulna are the two bones of the forearm. Here, inner to the radius is ulna, and on the outside is radius. Here, ulna is medial to the radius, and the heart is medial to lung. Heart is at the center, lungs are on its sides, and so heart is medial to the lungs. Lateral, the structure which is located away from the midline of the body. Here example, radius is lateral to ulna. Radius is lateral away from ulna, lateral to ulna. Okay. And kidney is lateral to the vertebral column. Kidneys are located on both sides of the vertebral column, and hence the kidneys are away from the midline when compared to the vertebral column. So kidneys are lateral to the vertebral column, or else lungs are lateral to heart. Then proximal, the part which is being described is nearer to the point of attachment or nearer to the point of origin of a body part. Example, knee is proximal to ankle. Knee is proximal to ankle. So knee is proximal to the ankle. This part, the upper part of the tibia, is proximal to that of the distal end. Yeah, the lower part. So this is proximal, and down is distal. So here this joint is proximal, and this is distal. Elbow is proximal to wrist. It's another example. The next is distal, the part which is away from the point of attachment, the part which is away from the point of origin. Wrist is distal to elbow, and ankle is distal to knee. Ankle is distal to the knee. Right. Then superficial, the structures which is located on the surface, nearer to the top. Skin is superficial to the muscles. When you compare skin and muscles, skin is superficial to the muscles. Cornea is on the superficial surface of the eye, are its examples. Then deep, the structure which is located away from the surface, opposite to that of superficial. So bone is deep to the skin. Bone is present deep to skin, below the skin. Then prone position. Prone position, this is the body position in which a person lies flat with chest down and back facing up. You can see that here in the diagram. This is prone position. And supine position, here the person is lying down in a position that in which the chest is facing up and back facing down, and this is supine. And palmar, this is the term related to the palm, in front of the hand. And plantar, this is the position relating to the bottom of the foot, the sole of the foot. And so the applied anatomy, here the knowledge of proper body positioning helps in performing specific procedures correctly. For example, supine position for ECG recording is maintained, and for general physical examination, supine position is maintained. Then anatomical plane or the body planes. So anatomical planes or the body planes are the imaginary flat planes that pass through our body, which include sagittal plane, frontal plane, transverse plane, oblique plane, etc. You can see that in the diagram. There's the imaginary planes passing through the various planes of the body, which may include frontal plane, sagittal plane, transverse plane, oblique plane. Okay. So sagittal plane, which includes mid-sagittal plane and parasagittal plane. Mid-sagittal plane is the vertical plane passing through the midline of the body. The plane passing through the midline of the body is the sagittal plane or mid-sagittal plane. And the next is parasagittal plane. This is a vertical plane as like the mid-sagittal plane, but it is not passing through the midline of the body. This is passing through the right or left of the midline of the body. The right or left of the midline of the body. The vertical plane passing through the right or left of the midline of the body. The next is frontal plane or the coronal plane. It divides the body into anterior and posterior portions, which is dividing body laterally into anterior part and posterior part. It is dividing body anterior into anterior and posterior. Then transverse plane or the horizontal plane, it divides body or the organs into superior and inferior portions. Superior portion and inferior portion, dividing the body transversely, the transverse plane. And the next is oblique plane. The plane passes through the body at an angle obliquely between the transverse plane and the sagittal plane. Between the transverse plane and the sagittal plane, the plane passing obliquely. Then, applied anatomy, the knowledge of anatomical planes is essential for interpreting or reading X-ray, CT, MRI images. Then anatomical terms relating to the regions of the body, and they can be called regional terms. These are the terms used to describe a specific region of the body, a specific location or part of the body. The body can be divided broadly into two main regions, axial region and appendicular region. Axial region includes the head, vertebral column and the trunk. The main middle part of the body is the axial region, and appendicular region includes the pelvic girdle, shoulder girdle, upper limb, lower limb, etc. And each of these regions, axial and appendicular region, can be divided into descriptive regions further. The first one, cephalic region, refers to head. Frontal region refers to forehead. Orbital region refers to eye. Otic region refers to ear. Nasal region refers to nose. Oral region refers to the mouth. Buccal refers to cheek. Mental refers to chin. You can see those regions here in the diagram. You can see cephalic, frontal, orbital, nasal, oral, mental, all these. The next, cervical region refers to the region of the neck. Thoracic refers to the chest. Mammary refers to the breast. Sternal refers to the anterior middle chest where the sternum is present. Umbilical refers to the navel. Then abdominal refers to the region of the abdomen. Coxal refers to the hip. Pelvic refers to the pelvis. Pubic refers to the pubis. Axillary refers to the armpit. Okay, here you can identify those regions. So cervical refers to the neck. Sternal refers to the anterior middle chest. Mammary refers to the breast. Thoracic refers to the chest, the whole chest. Then abdominal refers to the abdomen. And umbilical refers to the umbilicus, region of the umbilicus. Coxal refers to the hip. Pelvic related to the hip. Right. Brachial refers to the arm. Antebrachial refers to the forearm. Antecubital refers to the front of elbow. Carpal refers to the wrist. Palmar refers to the palm. Digital refers to the fingers. Manual region refers to the hand. Inguinal refers to groin. Then femoral refers to the thigh. You can see that in the diagram. Axial refers to the armpit. Axilla. Then brachial refers to the upper arm. Antebrachial refers to the forearm. Then antecubital refers to the front of elbow. Then carpal refers to the wrist. Then palmar refers to the palm. Then digital refers to the fingers. Then manual refers to the hand. Inguinal refers to the groin. Inguinal. Then femoral refers to the femur. Then we'll discuss further. Patella refers to the anterior part of the knee. Popliteal refers to the behind the knee. Crural refers to the leg, anterior part of the leg. And sural refers to the calf of, back of the lower leg. Then tarsal refers to ankle. Pedal refers to the foot. Then plantar refers to the sole. Hallux refers to the great toe. And calcaneal refers to the heel. See that here. Femoral refers to the thigh. Crural refers to the anterior part of the lower leg. Then patella refers to the knee. And popliteal refers to the back of the knee. Popliteal, back of the knee. Then sural refers to calf of the muscle. Then tarsal refers to the ankle. Calcaneus refers to the heel of the foot. Then plantar refers to the sole of the foot. Hallux refers to the great toe. Acromial refers to the shoulder. Scapula refers to the back of the shoulder. Then vertebral refers to the spinal column, vertebral column. Dorsal refers to the back. Lumbar refers to loin. Sacral refers to between the hips. And gluteal refers to the buttocks. Here, acromial refers to the shoulder. Then scapula refers to the region of the scapula, back of the shoulder. Then dorsal refers to the back. Then lumbar refers to the lumbar region. And sacral refers to down to the lumbar sacrum. Then gluteal refers to the region of the buttocks. Perineum is the region between the legs, between the anus and external genitalia, is perineal region. Okay, that was about the regional terms. So that was all about the introduction to the anatomical terms.